Guys, so I thought I would do a update on my appointment yesterday. I went to the plastic surgeon that I found locally, who was great to sit and talk to. He understood all of my concerns and really just kind of let me talk and address some issues that I thought needs to be looked at. So, the first thing I have to do is go for a CT scan so he can see exactly where the plates are, where screws are, where different bone grafts that I've had are, and see exactly what's underneath, so he can determine how much he's going to be able to fix for me and see if he can fix the things that I need or that I want fixed. We talked about possibly doing fat injections around the eyes to fill in some holes where there's just no bone structure. Also talked about possibly removing an implant that I have here under my eye because it's just not even on this one. On this side I don't have any implant, and this one I have a rather large one. It starts here and runs all the way across and down to about here, and it's just uncomfortable. So we talked about removing that. We also talked about fixing this. It is kind of crooked. I've had maybe 3 or 4 reconstructive surgeries just on my nose. So I think just a cosmetic little operation just to kind of thin it out, make it a little straighter, give it just a better look, better feel, kind of just to narrow it down so it fits in better with my face. And that was basically it, but he was very positive and just explained to me that a lot of craniofacial patients go through this, where they've had so much reconstruction. Everything's been great. You know, I am so thankful to my surgical team that I had from birth. They did amazing things. They did wonderful. They were able to get me to where I am today. And I think now it's just more on the cosmetic side. I don't know if anybody else has gone through it, where you just get to a point where the reconstruction is done, but now it's just the cosmetic work that you would kind of just like to see a little improvement here and little stuff done here and there. So that's where we're at now. So I'm waiting on my insurance to approve the CT scan, and then I'll go have that, and then 7 to 10 days I'll meet back up with him and see what he's able to do. So it's really exciting. So I'm pretty happy. I think it's just time. I'm 35, and it's just something that I've always dealt with. And I'm looking forward to it. So thanks for watching. Subscribe so you can follow me along in my journey, and leave me a comment, leave questions, anything. I plan on doing like a story time, just kind of going in stages to, you know, birth, how my parents reacted, what kind of happened in the first few days after I was born. Was as a reminder, back in 1981, they didn't have any ultrasound or anything to diagnose. So it was a surprise to everyone. I am the 3rd out of 4 children. So they had had 2 children prior to me, and nothing, no issues, no trace of this gene mutation. So I'll kind of get into all of that, but I just want to give you guys a quick update. Again, thanks for watching.